Good morning. My name is Tommy Clyburn. And first, I just want to say thank you for a minute of your time as I tell my story of a recovery of a deadly disease that I was notified of back in February of this year. Thank you all for coming. We appreciate your time. Well, it happened for the most part pretty fast. What happened to me was I was doing a job and blacked out. And when I came to, I realized I needed urgent medical attention. Now, before the blackout stage, let me back up just a little bit to let you know before that happened, I had signs and symptoms that I didn't understand what was going on. I'm 49 years old, so I was assuming that just due to the years I've been on Earth, it comes with the territory. I was assuming that's what it was, but I was wrong. Uh, there again, before the blackout, I had several issues. One was frequently urinating, and I stayed thirsty as all out for 24 hours a day. I couldn't get enough to drink. I had to have some liquids to drink on at all times. My mouth was dry as dirt all the time. Restless nights, getting up, using the bathroom all the time, and just a moment to fast forward. Shortly after that, I started to see blurry. My vision was getting worse, but I was still trying to have a positive outlook, thinking that it would pass, like a headache or a muscle ache. But sad to say, it never did, and the symptoms got worse, and so did I. And after the blackout, mid-February of this year, I admitted myself, took myself to the ER, the Presbyterian Hospital Novant Healthcare System, uh, took me in and helped me. I was extremely reluctant about getting any kind of medical attention, even when I was having the symptoms, due for the simple fact that I have no health insurance. The last time that I had health insurance, a small company that I was working for went out of business, and I couldn't afford to pay out of pocket for it, and I've just been fortunate up until this point. So while at the ER, they checked some vitals on me, blood pressure, asked a series of questions, and one of the things that they did do was they pricked my finger and put some blood on a little strip. And I had seen it done before because my mom, she was diabetic, and I had a couple of other family members that were diabetic. Never dawned that it would hit me, but they came back in about an hour and said that my sugar levels were over 400. Uneducated about it at the time, it still hadn't sunk in as well as it should had, but the number alone scared me. 400 seemed to be a high number for anything. So we continued to stay at the hospital. Some doctors came in and told me how dangerous those levels were. It could cause organ failure, and if it continued on, possibly death. With their concerns, and I thank God for that, their concerns were my heart and organs, liver, kidney, and so forth. So they admitted me into the hospital for further tests. Well, as that night went on, I started to feel a little better because they were giving me liquids. My body was dehydrated. They gave me saline. They started to give me insulin, and it just at that point right there, doctor came in and confirmed that I was stage two, uh, diabetic. The following day, after some of the blood work came back, they told me my AC1 levels were over 13 and that I had probably been diabetic for 3 months or better. So my body had took a tremendous beating. The hearing that, it was heartbreaking. You know, I'd consider myself to be health conscious. I consider myself to be the type of person that, especially as I'm getting older, to do the appropriate things that I need to do to continue living. You know, cut out a lot of things that I used to do even before I was diabetic. You know, not a whole lot of sweet stuff, and cut back on fatty foods. I'd done that already. But the mental aspects of what it was doing to me after I was told I was diabetic, it terrified me. Knowing that that was going to be change of life. And the bottom line to what I was already dealing with or gonna have to deal with the rest of my life was the fact that I'm sitting in a hospital with no health insurance. How am I going to manage to get the medicines that it's going to take just to stay alive? You know, and I talked to several family members and some church members, and all were encouraging me to, fight it with the good fight of faith and keep my head up, and you know, things will be provided for you. You know, even if you can't do it yourself. And I've always been self-sufficient, most of my life. So as the next 2 days pass, and mind you, these sugar levels are mine. Even though I'm getting insulin and they're hydrating my body, my sugar levels are still in the high threes. The lowest I seen the whole time I was at the hospital was maybe mid twos, but it never got down to what they suggested would be normal levels for me, would be between 80 or 90, no more than 120. But I did notice, like I said, start to feel better. I stopped using the bathroom so much. The vision was still a little blurry, but altogether, yeah, I'm starting to feel some change, a little slight bit of relief. But the problem that continued to pound on my skull was, how am I going to do this with no health insurance? As the days continued on, about the third day, the doctors had, done all that they could do for me, and told me that the kidneys were functioning well, liver and pancreas were. The liver is functioning well, but my pancreas is in recovery from the sugar levels being so high. So I'll be on insulin to help my pancreas process sugar and so forth. But as I'm getting ready to, I guess, be discharged from the hospital, several people came in. And the one person that came in, there was one person that actually came in. She's an educator on diabetes, the process of dealing with it, treating it, the diet that I'll have to follow being diabetic. She came in and completely within an hour gave me probably 10 or 15, 20 years worth of information in an hour. And still, it was overwhelming. But it was one thing that really stuck to me, was to absorb everything that she was telling me, because it would be vital in the near future, days to come. So I did. And then I had to give her the bad news that I didn't have any health insurance. So how am I going to be able to, what can I do? What's available? Do you know any resources that can help me get this insulin? If not, my days are numbered, surely. Fortunately enough, this young angel, this young lady, she provided me with some information that led me to somewhere that absolutely changed my life for the better. And it did. And it still is. It's called the Community Health Center in Union County. And as you can see, the expression on my face is starting to stretch out. It's a smile of joy and a smile of appreciation and love for these kind human beings that don't know me, don't know much about me, but there's a couple of things they do know. One, I'm uninsured. And two, I have a disease that could kill me. And with their kind hands and the kind community, they were able to help me establish some understanding about the diabetes and just provide me with the things that I need to stay alive. And I couldn't find help anywhere else. I was making phone calls trying to get insurance while I was in the hospital. Nobody wanted to, I'm can't get enrolled right now. Some insurance weren't taking people that was, just got diagnosed with diseases, and a lot of hope was really dim until she told me about the Community Health Center. Skeptical enough, it was like it's too good to be true. A couple of days after I got out of the hospital, I went to the community center, the Community Health Center, and just as soon as I was buzzed in and opened the door, a warm feeling in this place just covered me. I'd never been there before. It was just like a fountain of peace just got poured all over me. I knew, even before I got seen by a doctor or a nurse, that I was going to be okay. Just to walk in the door, I knew that. I felt it. It's something that I never felt before.